Well, hello, I'm Doug Apple, back with another special interview for you today. The news was just announced, I heard, that President Biden said that he will debate Donald Trump. It gets me thinking about, well, what's the difference between Biden and Trump? What's the difference between the average Democrat and the average Republican when we're thinking about health care? Health care is on the minds of everyone. Health care costs, health insurance, how to get your bills paid for without crashing your family budget. We're going to be talking with Mike Sharman. He's the legal counsel for Share Healthcare. You've been hearing their ads here on Wave 94. They bought a little airtime. You can always find more information about them at sharehealthcare.com. But here's one little thing I want to start off with as we talk with Mike Sharman. And this is a headline that was in the Washington Post. And it said, did Obamacare massively increase the cost of health care? Let's check the facts. And what they're stemming from is former Louisiana Governor Bobby Jindal said that Obamacare was sold on a lie. It massively increased the cost of health care in America. Well, their fact checker at the Washington Post says that Jindal is not telling the truth on that. One of the quotes from the article says that of all the things Obamacare, the Affordable Care Act, was trying to do, it says none of this is free. The Congressional Budget Office estimates that over the next decade, Obamacare subsidies will cost about $1 trillion, and another $1.4 trillion will be spent on the ACA's expansion of Medicaid. All right, well, then they go back and quote Bobby Jindal as saying, President Obama said that the purpose of the ACA was to lower the cost of health care. He did not lower costs, but instead merely shifted costs to taxpayers. When an enrollee qualifies for subsidies, the cost of the health coverage does not disappear. They are just shifted to the taxpayer. Well, of course, Mike Sharman, you know that is true. And as we look at the national debt, you've used the word insolvent. We can't just keep adding more and more to the government budget in handouts and subsidies. And yet, one of the articles you and I were looking at before going on the air is that people generally approve of these subsidies and handouts. Well, of course they do. If you're getting something free from the government, you tend to prefer that versus paying for it out of your own pocket. And yet we have a national debt that has put us in a place of insolvency. So, Mike Sharman, I'm going to pass this ball to you and see where you can run with it.
Well, I would trust Bobby Jindal more than I would the Washington Post reporters. But actually, when you look into that Washington Post article and you just look at the numbers as opposed to the adjectives and editorializing within the article, they point out that the Congressional Budget Office says that Obamacare subsidies, those taxpayer payments to those who Obamacare deems to be worthy of a subsidy, is going to cost $1 trillion. And then indirect ones going to the states is $1.4 trillion, which is spent on the Affordable Care Act, Obamacare's expansion of Medicaid. So, and I say going to the states. States do Medicaid, but they have to kind of partner with the federal government. So that $1.4 trillion is federal money spent in the states for Medicaid, and then $1 trillion. So that's $2.4 trillion that is being spent just on the subsidies. So what most people are thinking of this election cycle is inflation. What causes inflation? Well, too much money being pumped into the money supply. And here you have $2.4 trillion being spent on medical expenses, which will also push up the price of those medical expenses, which is what's occurred. So it's not just merely that the expense for people is in their increased premium, insurance premium, which is true for those that aren't subsidized. But those that aren't subsidized are still winding up having to pay taxes, too, for the cost of that subsidy. But then the medical expenses themselves have increased. So there's nothing about healthcare that has not gone up since the passage of Obamacare, and not gone up tremendously. So what Share Healthcare is a nonprofit 501c3 ministry. It's a Christian ministry, and the specific type of ministry that it is healthcare sharing ministry. We share one another's medically necessary medical expenses. One other thing that Obamacare had done, which increased the price for everybody, is it mandated that certain essential, what they call essential medical care, has to be paid for in insurance. And it dictates that to all insurers, whether or not they wanted to. So, you have to do birth control. You have to do abortion. You have to do, and now rulemaking is by the executive branch is making it, you have to do all this transgender care. Well, as a 501c3 ministry, as a defined healthcare sharing ministry, defined under the Affordable Care Act as being exempt from the Affordable Care Act, we don't have to do that. And so our members, since they are trying to live biblically, one, they have better health outcomes, but two, they don't have to subsidize other people's bad choices. And so how's that wind up? Well, it winds up that a single per month will pay $149 for their share health care membership, $249 for a couple, and $349 for a family of four, and then $50 for each child after that. So that's the amount of money that it takes to share one another's medical expenses. And contrast that with what is the cost of the health care insurance for the average family of four across the United States. Well, that's right at $2,200 per month. $349 versus $2,200. Right there, you see the difference between what can happen when people live biblically and cooperatively, and then what happens when you have government dictating to people what they have to do and doing it in an ungodly way.
So Share Healthcare is a Christian ministry, and you talk about working with Christians who are living by a biblical lifestyle. Meanwhile, with health insurance, they have to let everybody in, and they are mandated to cover certain things. How can this Christian ministry, I'll use the phrase, get away with limiting these certain things that they do? Now, I see that it's keeping your costs tremendously lower, but I'm sure someone listening might be wondering, well, how can they get away with that?
As I just mentioned, we're exempt from Obamacare's mandates, the mandates of the Affordable Care Act. But we're also not insurance. We don't assume the risks of another, which is one of the basic definitions of insurance. You're assuming that somebody else's risk is going to happen, and if it does, you promise you're going to pay it. Well, Share Healthcare isn't that. It's passing the plate across the nation, across denominations. It is a ministry. It's not a business. It's not an insurer. And so because of that, we don't have to do all the regulatory requirements of the 50 states. And many of those states also require transgender care, abortifacients, etc., that you have to accept people who are alcoholics or using tobacco. Well, we don't. We don't share in abortions. We don't share in abortifacients. A person who is using tobacco, even if they're a Christian, can't join Share Healthcare. I'm a personal teetotaler, but apparently Jesus wasn't. He changed water into wine. But and the whole Bible speaks to moderation. So our requirement for alcohol use is moderation, 1 to 3 drinks per week. That's moderate. You can have a drink with a dinner or toast somebody at a celebration, but you aren't going to have the negative health effects from that type of moderation that you do with people who use tobacco and who drink in immoderation, drink to excess. So because of those ways of living biblically, we have reduced our cost enormously. I say we've reduced it. Our members do, just because of how they live. Then also, there's no getting around the fact that we are seeking God's face and trying to live according to His will. We have each individually, because this is a membership of Christians, we've each individually committed our lives to Christ. So that means we have His hand on us. Now, every one of us is going to have times of disease or destruction or decay and death. Every one of us will. But Christians have it more lightly than others. Just statistically, that is true. And of course, we have Christians who are just beset by one cancer after another, or some people we know who, for whatever reason, are just accident prone. Sure, that happens. But as a whole, as a people, as that part of one of the flocks of Christ, we just have less of those incidents, and our healing time is faster. There's study after study after study that just shows those things. So we're reaping the benefits of it, and that, Doug, is how we get away with it, so to speak, of it having only 149 per single, 249 per couple, and 349 for a family of 4.
Now, you talked about some people that are just more accident prone than others, which kind of cracks me up. It makes me think of a few people. How does share healthcare work for an accident prone person?
Well, we share their needs. Now, one of the ways that we are able to keep our costs down, our monthly costs down, folks, is while we don't have an annual limit, we don't have a per event limit, we don't have a lifetime limit on the sharing. We go in the opposite direction. We have, for that program that I mentioned, the 149, 249, 349, what we have is a $1,000 per event or per diagnostic course of treatment. That $1,000 is that person's or that family's load that they are to carry. We try to go on the biblical model of loads and burdens, that we all are supposed to carry our own load. But when the weight upon us is too great, the spiritual weight, and so we pray for one another, or the financial weight, and so we share with one another. When that weight becomes too great for us to carry by ourselves, it is a burden, as the Bible defines it, and that is to be shared. So let's say a person has cancer, and they've found out about it by going to the doctor because something was wrong, so that's a relatively small expense for that initial treatment. But then just one course of blood work, blood test, and one course of MRI, bam, they're up above the 1,000. So for however much it takes for that to be shared, above 1,000 is shared. For how many years it takes. But that first 1,000 is that family's load. Now, let's say they're walking into the clinic and they trip and fall and break a leg. Well, that's an entirely different diagnostic procedure, a diagnostic course of treatment, different event. And so a new $1,000 would apply on that. So, some people might say, well, gee, that could happen a lot. Well, not really. You don't have a whole lot of major events that occur like that. Mm-hmm. And people just need to make a decision. Well, would I rather have insurance, which has a high copay and high deductible, and pay $2,200 per month? Or would I rather do this, which has the $1,000 per event, or called per diagnostic course of treatment, however you want to phrase that, and there is no upper limit, and there is no copay, and there aren't any deductibles to be had. So, that's the practical decision people need to make. But more important than those practical and financial decisions, I believe, is that we as Christians need to start exercising our spiritual muscles and recognize that when Christ in his last prayer, and in John 17, when he's in the Garden of Gethsemane, he's praying that the church will be united, and then the world will see it, and the world will believe. Okay, when we've got to start exercising our spiritual muscles and come together so that the world does see that. But as Americans, we need to start exercising our freedom muscles. And here we have this tool that gets us free from so much of government bureaucracies at the federal and state level. And Christians need to use it. When we begin exercising these freedom muscles and they start to grow with medical sharing, then people will start looking around and say, well, how else can we exercise our freedom muscles? But if we don't use this strength that we have of being able to have freedom in this particular area, we're going to lose it. And it's a whole lot easier to lose a freedom than to regain it.
And if you do something like share healthcare, you won't be one of the people helping add to the national debt and future insolvency of the country. But Mike, as we wrap up our time, I do want you to circle back around on this idea of loads and burdens. And in fact, I'd like you to take just a couple of minutes and give us a little Bible study on the whole concept of loads and burdens and how that plays out with share healthcare.
All right, so we have that famous passage of Galatians 6:2, which is often used in healthcare sharing. And it says, bear one another's burdens and so fulfill the law of Christ. But then later, getting to your question, Doug, about, well, tell us about loads and burdens. All right, so there we have burdens. Bear one another's burdens and so fulfill the law of Christ. But then later at 6:5, just a verse 2 over, it says, for each one shall bear his own load. All right, so good hermeneutics, though, is say, look at that in context. So the context is spiritual. It starts at 6:1. Brethren, if a man is overtaken in any trespass, you who are spiritual, restore such a one in a spirit of gentleness, considering yourself lest you also be tempted. And then it goes on to bear one another's burdens and so fulfill the law of Christ. So it's talking about prayer, not sending a check in to help one another with medical expenses. But this context, though, lets us see practical applications. Well, if that's true spiritually, that if we see that somebody's overtaken in any other problem, well, we who are able ought to help restore that person. We who are able ought to help bear that person's burden and so fulfill the law of Christ, which is love, which is caring for one another, which is caring for our neighbor more than one another, and starting with the church. And then, but there we have that caution. But each one shall bear his own load. So that premise of, well, everybody ought to have a little skin in this game, that everybody needs to be able to pay what they can on their own medical expense. And we've looked at, well, statistically, what can people tend to be able to have in their savings that doesn't disrupt their whole household economy. Most people can either have or budget for that $1,000 per event, per diagnostic course of treatment that we have. But above that, it's a real burden that the body of Christ needs to come along. So that's basically where we get that premise of burdens and loads. Again, that's expressed in Share Healthcare's life verse, so to speak, of Hebrews 13:16. But do not forget to do good and to share, for which such sacrifices God is well pleased. So we're fulfilling all of those things in this little 501c3 Christian ministry, Share Healthcare. And don't we all want to be part of something bigger than ourselves? And don't we all want to be able to change the environment that we're living in now of a culture that seems to be getting more and more corrupt, more and more self-centered? Well, how do we change that? By ourselves choosing to be right with God rather than self-righteous. Doing what God says is just rather than being self-justified. And as we look toward others and help them, we are lifted up. Just emotionally we are. But God lifts us up. And that's when, even while we're still alive, He lets us know in so many ways, well done, good and faithful servant.
God's ways take crooked things and make them straight. And if you're listening today and you feel like your whole health insurance, healthcare coverage, health plans are feeling a little crooked, maybe God's ways can help make them straight through this ministry of Share Healthcare. If you'd like more information, you can call them at 1-844-SHARE-HC, or you can check it all out on their website, sharehealthcare.com. You've been listening to Mike Sharman, and for Wave 94, I'm Doug Apple.